Hey guys. Oh, I think it was trying to freeze up on me. Okay, so hopefully you guys can see this. So we are going to go over endocrine disorders and endocrine drugs and diabetes today. I have two different PowerPoints. I should have just put them together, but I'm going to go over each one. The first one is just going to be over endocrine disorders, not diabetes, and then we'll go over the diabetes only PowerPoint. The first one's pretty short, so let me present here so you can see what I'm seeing. It's like 4 slides. It's really quick. There are a lot of endocrine disorders, but the ones that they want you to know are just like the major ones. So that's kind of a good thing. And they want you to just know like what drugs go along with them. So birth control and contraceptives for women. This is to prevent pregnancy, obviously, but it's also indicated for women with irregular periods, painful periods, or who have PCOS or polycystic ovarian syndrome. These are endocrine issues with women that they can go through. And so they do have side effects. Birth control has side effects. And some of the bigger side effects have been a little scary, especially for women who are on them for a long period of time. They've said that you can be at a higher risk for blood clots, just in general, if you are on them. So you got to be careful with taking that and just weigh the risk versus benefit. At the same time, you don't want to get pregnant. So if you don't want to get pregnant, I mean, I'm assuming all of y'all want to get through school and not get pregnant right now. But also there's people not just who are trying to prevent pregnancy, but may have some issues that, the risk still outweighs the benefit. So some examples: Yaz, Mercet, orthotricycline, and loestrin. I think these are the main ones that are on your list, and you need to know both the brand and generic names. I didn't put the generics on here. They're kind of long. Orthotricycline might be a generic, but make sure you know those and know the generic names. Male hormone issues, so impotence and inability to get or maintain an erection, enlarged prostate, aka benign prostatic hyperplasia. This is not necessarily, because they do put benign in the name, it's because it's not cancerous, but people who have enlarged prostates can or may have a higher risk of getting prostate cancer. And then drug examples: Cialis, Viagra for impotence, and then Proscar for benign prostatic hypertension and urinary issues. Even hair loss it can help with, Proscar can. So I think there might be 1 or 2 others they added on the list. I'm not even sure. So list, just so you know them, because who knows if they'll ask a question. They're pretty common medications. But like for this year, for some reason, I think they're like right above the 200 list. So I just still added it just in case the test doesn't update or something. I don't know. Okay, so thyroid hormone replacement is indicated when thyroid is partially or fully removed, diagnosis of low thyroid hormone. So either they don't have any of the hormone because they had to have it removed, or they have low thyroid hormone. And some examples: Synthroid, think synthetic thyroid hormone, Synthroid, and Levoxyl. Both are levothyroxine, which is the generic. And I think that was the only thyroid one out there, like the 2 ones that you needed to know. One thing to note that they did ask on the test at one point over the last few years, one of my students said they asked which medication needed to be taken on an empty stomach, and that was actually thyroid hormone replacement, or I think Synthroid was the answer. That is one thing you need to note. Is it's kind of random, but a indication for this medication, or not an indication, what are they called, like an alert, or a my brain is blanking. An auxiliary label that might be on there is to take on an empty stomach, and that is one thing that's really important for patients who take this medication. They need to take it on an empty stomach. And then estrogen modulators. A specific drug to know is Evista. It was on the top 200 list. I don't know if it still is. I think it was, actually. I had to go through all the lists and like update it, and I couldn't remember. But it's indicated for the reduction in the risk of invasive breast cancer in postmenopausal women with osteoporosis. It can also treat and prevent osteoporosis in women who've gone through menopause. So it does a couple things. And so it's an estrogen modulator. That's the like the classification. Okay, so that is that. Those, I told you, it was pretty short. And then we're gonna open up the other one, which is a little bit longer here. And this is on diabetes drugs. So diabetes is one of the most common. It's one of the most common. What's it called? You guys, this is right before lunch, and so I'm like losing my mind. I need to eat. It's a common condition, a very common condition in America specifically. A lot of it is type 2 diabetes, which can be improved with diet and exercise. They've always talked about the American diet being really unhealthy and all of that. So definitely some diabetes can be treated with diet and exercise. They're actually not making what they need to make from their pancreas, like the it's not type 1 is less common, but type 2 is really common. So anti-diabetic drugs used to treat control diabetes mellitus, a chronic condition or chronic disease that affects carbohydrate metabolism. There's two groups of anti-diabetic agents. You've got insulin and you've got oral hypoglycemic agents. Oral hypoglycemic agents are synthetic preparations that stimulate insulin release or alter metabolic response to hyperglycemia, while insulin is a protein created from the beta cells of the pancreas. And if you get insulin, that's actual like insulin that's being given to you, like that's created and supplemented instead of your body making it. Diabetes mellitus type 1 and 2 is a chronic disease resulting from deficient glucose metabolism caused by insufficient insulin secretion from beta cells. So you're not making enough insulin. You may not make any, or you may not make enough. Polyuria is increased urine output. Polydipsia is increased thirst, and polyphagia is increased hunger. All of those things can be associated with diabetes mellitus. So you got two forms of diabetes. You've got insulin-dependent diabetes mellitus, or type 1. It was referred to as juvenile onset with no insulin secretion. At one point, it was called that, but it could be, adults can get it now too. Like they can just stop making it at some point, but it's more common to start in childhood. It can also be genetic or hereditary, but sometimes not. But I knew someone who had it, and his dad and his brother both had it as well. So it can be something that is passed down genetically as well. Non-insulin dependent diabetes mellitus, or type 2 diabetes, was referred to as maturity onset or adult onset diabetes with some insulin secretion. So it's lifestyle related. So basically, your body, is making some, but not enough. It could be lifestyle related, like you're insulin resistant because of how you're eating and how your body is metabolizing carbs. So unknown how lack of insulin causes diabetes, possibly infection, hereditary. Again, we don't know. Insulin is released from the beta cells of the islet of Langerhans in the pancreas in response to an increase in blood glucose, and promotes the uptake of glucose, amino acids, and fatty acids, and converts them into substances stored into body cells. So it's really important that you have insulin, that it is working correctly, and that your body is using it correctly. Glucose is converted to glycogen for further glucose needs in the liver and muscle. So let's see. What do you need to know? You don't need to know that. Insulin can come from animal or human, and insulin cannot be given orally. That's one big question, is that it cannot be given orally. It has to be given in an injection. It will be killed with stomach acid. For accurate dosing, insulin can be given needs to be given in insulin syringes only. That's another big thing, is that you will have specific, if you work in the pharmacy, you'll have specific instruction for insulin, because it does have to be usually refrigerated, and you'll have instructions for the patient on packaging and syringes and like how that's going to work for them. So insulin needs to be well mixed, but always roll between your hands. Never shake it. That's something that you'd probably, the pharmacist would probably tell the patient, but you need to be careful with as well. It cannot be administered orally, like we talked about. The GI tract destroys it in the gut. It's given subcutaneous. We talked about that back when we talked about parenteral versus enteral and just like the different kinds of injections given. And it's given at a 45 to 90 degree angle. And insulin sites need to be rotated to prevent lipodystrophy or tissue atrophy or hypertrophy. Basically, that can interfere with insulin absorption. So that's why they have to switch where they do it in their body. So it's given in a syringe, a needle connected to a hollow tube that holds the insulin, and the plunger that pushes the insulin down and through the needle. Insulin pen is a device that looks like a pen and holds insulin, but has a needle for its tip. And then you have insulin pumps. These are small machines worn on the patient that hold insulin and pumps it into a plastic tube under the skin, where it stays for several days. I have a friend of mine who has this, actually multiple friends that have this. Most people who have diabetes, if they have the money for it, can get an insulin pump. But I've known people who don't have them either, that just couldn't afford it because it was really expensive. Hopefully it gets cheaper, especially for people with diabetes type 1. I mean, that's something that they can't help. That it's not like a, lifestyle situation. It's like they're like, literally it's their life, and it's life or death. It can be life or death for them. So I think it's really important that these people get that medication, and the pump just helps them, because even at night, their insulin can drop so low, and then people have died from from the inadequate insulin that they needed at the time. Anti-diabetic agents, you've got rapid acting, like Humalog. You have intermediate acting, which has a duration of 18 to 24 hours. And then you've got long acting like Ultralent, or Lantus. Lantus is another option, or another name you might see. You'll have to check the names, like the most common ones on the list that I have, because I did update the list this year with more common insulins and anti-diabetic agents. Lispro insulin, or Humalog, is a new rapid-acting insulin approved in 1996. Combination insulins are commercially pre-mixed, so you don't have to mix them. And then we've got oral agents. So these are not oral. Remember, oral agents are not insulin, but they can help with glucose metabolism. They can help with mostly type 2 diabetes. So for sure, metformin or glucophage, that's a really common one. This is indicated for type 2 diabetics, and can help them become more insulin sensitive. So using their insulin, like it being able to be used and utilized better in the body. And then there's a newer class, bigenonides. These are, I think there's one on the list, but I can't remember. So when you're filling this out, you'll have to put the drug class that it is, because biguanides is metformin. I forgot about that. Like it's one of them, but I think there was another one on the list. I can't remember. And so it's they want you to know it's an anti-diabetic agent, but it's an oral anti-diabetic agent. Let's see. Metformin can cause some side effects. I don't really know if they want you to know side effects for this one, but they might. And it can be combined with insulin too. Okay, then Amaryl, glucotrol, and diabeta are oral blood glucose lowering drugs of the sulfonylurea class. I can never say that right. They lower blood sugar by causing the pancreas to produce insulin and help the body use insulin more effectively. These are not used to treat diabetes type 1, but they do treat lifestyle-related diabetes type 2. And that's it, you guys. Not too much. Let's save this. Yes. That was less than I thought, so that's good. So let me stop presenting here. I think that's all I wanted you guys to know. That is the endocrine and diabetes disorders. Hope you learned something, and I will catch you later. Bye.